Welcome to the April 2025 SHARP information session, where we invite speakers to offer information sessions about resources, services, and tools available to help English-speaking seniors age in the right place. My name is Erica Botner. I'm the program manager for seniors and the SHARP program at CHSSN. I'll be the facilitator for today's session. Today we have two great guest speakers with us. We have Marie-France Juneau from Nova West Island, a private nonprofit home care organization, and François Robert from ÉESADs, a network of social economy enterprises that offer home care services in regions across Quebec. They'll be sharing information about ensuring safety and independence as you age with home care support, including what's available, how it can help, how to request services, and important resources like financial aid, and the upcoming national policy in home care. So Marie-France Juneau is a registered nurse and has been the executive director at Nova West Island for the last 15 years. She teaches nursing at Cégep and university and has published articles and presented at conferences at the provincial, national, and international levels. And François Robert is a communication and public affairs advisor with ÉESADs. With a background in research, journalism, and politics, he is particularly interested in social questions and equity in public policies. So the presentation is going to be in two parts. We're going to have Marie-France present first.
Good morning, everyone. Thank you for the invitation. I'm very happy to be with you this morning. I'm the proud director of Nova West Island, and I've been for 15 years. I'm not going to focus too much on the West Island because I know that you guys are from all over the province. So I'm going to try to give you some resources that you can tap into. Just for the people that are on the island of Montreal, there's two other branches of Nova, one in Hudson and one in Montreal. Basically, we offer in-home nursing care for palliative patients, people living with ALS, cancer, or who have a diagnosis of end of life. We also offer bereavement counseling for adults and children, and they are offered in person. We have a senior activity program, and the reason why I'm mentioning it is all of you guys can join on our virtual exercise classes. So our senior activity program is the virtual component. We have activity centers for seniors living with neurocognitive impairments like Alzheimer's or dementia. And we also offer one-on-one in-home stimulation. And finally, we offer a home support program with orderlies that offer hygiene care, and most importantly, respite for the caregivers. What we're noticing is there's an increased number of seniors in the province, and I was just at a meeting yesterday, and the statistic was just mind-boggling. As of 2030, it is estimated that 25% of the population in the province will be 65 years old or older. So there's definitely a need for social gerontology or gériatrie sociale programs. And typically what they do is they train people to identify vulnerable seniors and to help them out and provide them with appropriate resources. What we're seeing in the West Island of Montreal, and I think it's pretty much across the province, we need more home support resources. We need home health aides or people that are trained as préposés aux bénéficiaires or orderlies. We get phone calls on a weekly basis for house cleaning. We get phone calls also related to respite for caregivers, and we need more caregiver resources. But I don't think that's specific to the West Island. I think it's pretty much the same across the province. So the benefits of home support, why do we offer home support? The government always talks about le maintien à domicile, les soins à domicile. So you want to promote autonomy and independence. And what we're looking for is to improve the well-being of people and their families, their caregivers. People need help with personal care assistance. And again, I'm not going to stress that enough, but we need to offer respite for the caregivers because they deserve some time off. So I'm going to tell you what it is that we offer at Nova West Island, and I think a lot of non-for-profit organizations offer that as well. So we offer hygiene care like bathing. It could be a bed bath. It could be a shower, a bath. We offer toileting, help with getting dressed, shaving, setting hair. We're not hairdressers, but our préposés will gladly help people with a simple hair setting, filing nails. We do laundry and we change the bed linens. We prepare a meal, not like a Sunday roast beef dinner, but we'll do a meal or a snack preparation. We help with mobilization, and exercise in seniors is of utmost importance, and it's often something that people don't engage in. So we try to help our clients walk indoors, walk outdoors. Part of our, as I mentioned before, our virtual programming, we have twice a week exercise classes. We use weights. One of the exercise classes is a bit more active. Another one is more like meditative, like yoga and stretching. You have to keep in mind that when you reach out for home support, it's not typically an emergency service. So it's something that is organized in advance. And we hear at NOVA all sorts of horror stories where the CLSCs are involved, excuse me, and they send in staff that show up late, leave early, don't show up at all. I just, at a meeting yesterday, a colleague was telling me that her mom's préposé came at 3 to give her her shower. Well, she was already up and about by 3 o'clock in the afternoon. So at NOVA, we promote fluidity, continuity of care. So it's always the same préposé that goes in. So it makes it easier for our staff, for the caregivers, and more importantly, for the clients. What are some services that can be offered through home support? So I've mentioned activity books. So our senior activity program staff is very, very creative, and we can email you activity books no matter where you are in the province. So I'm going to give you some examples. We did one for International Women's Day. So discussing through the activity books and different activities, were some women so important to our history? Sometimes there's adult coloring that's involved, word searches, crosswords, quizzes, YouTube videos, music clips that are attached to them as well. They did an Elvis Presley day. They've done armchair travel to Brazil, Italy, etc., etc. So those activity books can be emailed to you free of charge, and they're fun. And whether you're living, our clients are living with a cognitive deficit, but I use them with my mom who's not living with a cognitive deficit. So there's something that, on a day like today where there's snow flurries and you want to stay inside, it's a good way to pass a couple of hours. Our virtual exercise classes I've mentioned already. Again, I'm going to put the email link to my colleague, Ashley Ann Gordon, who's the Senior Activity Program Coordinator. And you can reach out to her if you're interested in receiving the activity books or engaging in our virtual exercise classes. Another activity that we find that seniors enjoy are webinars. There's all sorts of webinars that are offered by many different community organizations, whether they're related to legal issues, whether they're related to health issues, social services issues, or just fun webinars. So don't hesitate to sign up. They're fun, they're free. We also have different community organizations that offer friendly callers or daily hello phone calls or what have you. We have some clients that in the West Island that their only social interaction is with the people that call them once a day or once a week or what have you. In our in-home support program, and this is something that you can do in your own organizations, we create stimulation or reminiscence kits. So these kits are put together by our senior activity program staff. And what they are kits that can be used by the clients themselves or their caregivers or the family, it's in its entirety. So basically, we look at what the person used to do for a living. For example, if somebody was an avid golfer, we might put a crossword or word search related to golfing. We might put some quizzes related to golfing. If somebody was a gardener, there might be some adult coloring related to like flowers or fruits or vegetables or what have you. So, and these kits stay in the home with the clients, and we update them as we go based on the feedback that we receive. Also, in-home safety is a big issue, and I'm not here to sell you anything, so I just put in the ones that we know. There's some GPS trackers like that. Some of them are like even in the shoes. They're called GPS Smart Sole. And basically, if you're living with someone with a neurocognitive impairment, they can prevail themselves of this service at a cost, of course. But then if the person wants to go out for a walk and they have a tendency to get lost, or you're concerned about their safety, this is something that you can purchase. Medical alert bracelets. I'm a nurse by training, as Erica mentioned. So medical alert bracelets are very, very important. If you have any chronic condition, whether it's a cardiac issue, diabetes, seizures, what have you, it's very important that you wear those at all times. And then there's the fall detection devices, like Lifeline is an example, and it's probably the one that's best known. So those types of safety devices can help you stay at home longer and safer. What are some community resources that are available to you? So you can have CLSC services and private sector services. So one does not exclude the other. So you can receive services from both at the same time. Clearly, through the CLSC, the services are free. But right now, I'm not sure about the rest of the province, but on the island of Montreal, they're few and far between. So often seniors are turning to the private sector. The Centres d'Action Bénévole, or the volunteer bureaus of your areas, offer many, many different services. Here on the West Island, they're the ones who do the friendly caller phone calls. They also have exercise classes for seniors. They also offer Meals on Wheels or frozen meals. Here, the cost is $13 to $16 per meal, give or take. But it's often a good way if you're no longer capable of cooking, or you don't have the time or energy, or you're sick or what have you. That is a really, really good resource to tap into. And then through Volunteer Bureau, you can also volunteer clearly. And we find that seniors that give of their time, of their skill set, stay home longer, and it gives them an opportunity to socialize. There's also services that are available for accompaniment, for transport services, for medical and social needs. In the West Island, there's ABOVAS, which is Accompagnement Bénévole de l'Ouest, or Volunteer Accompaniment Service. So basically what they do is, for a cost, they will take you to your medical appointments, whether it's chemotherapy, whether it's a diagnostic test, it's eye appointments, what have you. And for the last couple of years, they've expanded their program to include social accompaniment to help people get to the grocery store, the drugstore, the bank, and all sorts of different appointments that they might have. Off island, I know like Vaudreuil-Dorion area, there's L'Actuel that also provides transport services at a cost. There's a number of available community resources also. If you look in the parentheses, crcinfo.ca, that's Community Resource Center. They have put together a wonderful seniors guide. I'm gonna show it to you on screen, and you probably don't see it very well. But basically, it's a publication. And in there, you will find everything related to foot care, home care, grocery stores that deliver. Clearly, there's an emphasis on the West Island, but you can find information about different services that are available. And there's always your MP or your MNA's office that can help you with that. A program that's not known as well as it should be is the Falls Prevention Program, or the stand-up program offered by CLSCs, and that's throughout the province. Le programme PIE, which is Programme Intégré d'Équilibre Dynamique. Basically, it's a falls prevention program. You do group exercises. They show you about home exercises, healthy habits, safety behaviors, fall prevention, home adjustments, et cetera, et cetera. So that program is offered to seniors, and it's very important, and it can keep you at home longer and safer. Equipment loans. At Nova West Island, we lend equipment to people, but there's other community organizations. So don't hesitate to reach out to your local community organizations to borrow, whether it's a bath chair or a bath bench or a wheelchair or a walker. A lot of places can lend them to you free of charge. There's an organization called Répit Ressources that is available on the island of Montreal, east and west, and they offer house cleaning, they offer help with shopping, or respite, personal care, etc. So Répit Ressources is the name of that organization. In terms of caregivers, I find that caregivers often find themselves very isolated and feeling lonely. So there's L'Appui pour Proches Aidants. They have a website, and basically their focus is to provide you with appropriate resources, and they have resources throughout the province that they can direct you to. Now, there's also the government resources, and people often wonder, when do I call 211? When do I call 811? And 211 is underused. So you call 211 and they will tell you about all the senior services available. But there's also like food banks, for example, that they can give you information about newcomers, people that are new to a given area or new to the province. Can tap into 211. Anybody living with any mental health or addiction issues can also contact 211. Justice advocacy, like if you need legal clinics and what have you, or even income tax clinics, they will give you that information if you call 211. When you call 811, basically you can expect 3 different types of advice. You can expect health advice given by a nurse, psychosocial advice, and primary care access point, le guichet d'accès. So if you don't have a family physician, you have a health issue, they might be able at 811 to direct you to a healthcare professional to help you with your given issue. And the Minister of Seniors, I've put it at the bottom, they've created a newsletter. So if you just type in Minister of Seniors newsletter, you can sign up for that newsletter. And that newsletter tells you about all the different programs and services available, well, in Canada, but in the province as well. I want to warn you, I'm not an accountant, I'm not a fiscalist, but I know that there's different tax credits that are available. And some seniors who have a good accountant will have told you about those, but in case you don't know, there's an age amount tax credit where you have to be more than 64 years old and you can transfer it to your spouse. There's a pension income tax credit. There's a Canada caregiver credit. Now that one, you have to be careful because the person that you're helping has to be living with you. So if you're in a situation like myself where you're helping a senior at home, but they're not living with you, you can't prevail yourself of that. But you can get up to $2,500 a year. The disability tax credit is when you help someone that has a permanent disability, mental, physical, you can prevail yourself of the disability tax credit. Medical expenses credit, often people throw out what they've spent on medical expenses, but if your medical expenses represent more than 3% of your net income, you can put those on your income tax forms. You also have the home accessibility expense credit. So when you want to do permanent changes to your house, you can get a tax credit for that. Typically, you have to reach out to them before you do the home renovation and not after. And the multi-generational home renovation tax credit, that's one that's not really well known. But if somebody is updating their home to allow a senior to live with them or next to them, it's up to $7,500. So those are all sorts of different tax credits that you can prevail yourself of. So I will, my PowerPoint presentation is available to Megan and Erica, and they can definitely send it to you. And the final thing is adapted transport. So adapted transport for minimal fee will take people with health issues to different appointments, and it can be even to social events. You have to book in advance, and you can do it on the phone or online. But adapted transport, again, can allow seniors to stay longer in their home because they will have transportation to get to their appointments or social activities. That's it for me for the time being. I'll be happy to entertain your questions later. Thank you.
François, whenever you're ready. Perfect.
Ask for your forgiveness if my English isn't perfect. It's not my main language, but we'll try to make sure you understand what I'm saying. So when you think about ÉESAD, what should you think about? You should think about a partner to help improve the quality of life of seniors. What are we? We're experts in home care support that you can rely on. What is an ÉESAD, you might ask? ÉESAD, it's the acronym for Entreprise d'économie sociale en aide à domicile. In other words, it's a domestic help social economy business or enterprise, if you prefer. They were created for and by communities. They promote citizen empowerment by giving community members the ability to take charge of their well-being. We work in partnership with the local community organizations such as the CIS, le CIUS, Wheels on Meals, as Marie-France said earlier on, such organisms. And ÉESADs, they are cooperatives or nonprofit organizations. They're all exploited as nonprofits with the mission to offer services and create jobs in their communities. Where do we come from? Where do ÉESAD come from? Well, a few events led to their creation. You might remember that many women took the streets and walked to be heard during La Grande Marche du Pain et des Roses in 1995. Then Françoise David was the leader of the Woman Federation. Maybe they walked in your neighborhood. You might remember the Economy and Unemployment Summit organized by the government of Lucien Bouchard in 1996. That's also an event that led to our creation. There was the creation of le Programme d'exonération financière pour les services d'aide à domicile, le PEFSAD, or if you prefer, the Financial Assistance Program for Domestic Help Services that was created in 1997. Of course, we'll talk more about that program later on. And also there was the adoption of the framework legislation on social economy in October 2013. And I've put the link if you want to know more about that. And you don't need to take notes about all I'm saying because we'll send you the presentation afterwards. So you'll have all that information to go back to. What's the mission of an ÉESAD? Well, it's to produce home care support services responding to the needs of their community, and that regardless of the type of home of their users. And as we talked a little bit about earlier on, it's also to create and offer jobs of quality to the population of their area. The clients of our services, they come from all social conditions, all types of environments. Most of our clients are seniors or people with permanent or temporary loss of independence, but we also have youngsters who can call to get a cleaning of their house and such. And we have now more than 100,000 people in Quebec who currently use our services, but with the aging of the people in Quebec, we can easily know that there will be more and more and more people asking for our services in the following years. ÉESAD in a few numbers has almost 100 ÉESAD in Quebec, members in all the regions of the province, and together, all the ÉESAD, they can count on more than 9,000 aides à domicile, or if you prefer, home helpers or home support workers. And at the end of May, we celebrate La Journée Nationale des Aides à Domicile to mark the importance in our society of the role of home care support workers working in ÉESAD. So you might see in May that we'll have many activities to make their role, make people understand that it's a very important role in society to help seniors every day. Services offered by each ÉESAD. These are the basic services. Some might offer more. Like, for instance, Marie-France earlier on said, we can help you comb your hair, but in some ÉESAD, they will also offer you to have a real hairdresser go to your place, and many other services. But we'll go over the main services. So we give personal assistance services such as help for your personal hygiene, help to dress, get out of bed, go to bed, take your medication and such. We offer respite for caregivers and present surveillance for their loved ones, light and heavy housekeeping, the preparation of meals, but except those part of a medically restricted diet, grocery shopping, and running other errands. So these are the basic services. But as I said, if you look on the website of your local ÉESAD, you might see that some offer more. How to find the nearest ÉESAD? It's very easy. If you go to if you go on the website of aide-chez-soi/en for English, you'll have the English version. We'll overview on the web. Have an overview, of the website on the next slides. So this is what looks like when you go on aide-chez-soi, and you see there's a little place where you can put either your postal code or your address or the name of the town you're living in. Just click on search and you'll come up to see what's the nearest ÉESAD and all the information, their phone number, their website, etc. if you want to find them. How to request our services? Also on the site aide-chez-soi, you can click on request our services, and then you'll have a little window that'll open up like that. Just put your name, address, all the information, the type of services that you're looking for, and someone will call you and get in contact with you to open up, how do you say, open up a dossier so you can get their services. Our services are made more available, accessible, and affordable with PEFSAD. We've seen a little bit about PEFSAD earlier on. As I said, it's le Programme d'exonération financière pour les services d'aide à domicile. It's a financial assistance exclusive to ÉESADs, and it's an incentive to use our services. So every Quebec citizen 18 years old and over can obtain the basic financial assistance of $4 per hour service provided. And you can also have that $4 plus between $2.63 and $21.60. That's the amounts for this year. And it depends on your age, your family status, family income, and the condition of the person in question. The services that are covered, it covers light and heavy housekeeping, preparation of meals, as I said, excluding the meals that are part of a medically restricted diet, grocery shopping, and running other errands, cleaning clothes. These are covered by PEFSAD. But we are now in discussion with the government to have more services covered by the Programme PEFSAD. There is an upcoming policy this year you might have heard about by Minister responsible for seniors, Sonia Bélanger, that she will present in 2025. And maybe, we hope that's what we asked for. We'll see if it's going to be done or not, but other services could be covered by PEFSAD before the end of the year. You can verify on our website, have an idea of how much you could get depending on your condition. So you just go on Financial Assistance Simulator, click on that. This is what it will look like. So they will ask you, you just have a few non-aggressive questions, not very specific question, just like if you're living alone, if you're in a couple, the bracket of income you have a year, your age, if you're 64 and under, if you're 65 and over, if you have a referral from the healthcare system, from the CLSC and the CIUS. So, and with just with those questions, you'll be able to know if you can get, like, for instance, $25.60 per hour of that the government will pay for each hour of services that you take from the ÉESAD are a little bit less. As Marie-France mentioned earlier on, our services, if you use our services, you can also have the tax credit for home support services for seniors, but it's another way to reduce part of the bill that you have to pay for our services, but you have to be eligible for it and ask for it. So you have to be 70 years old or more and have a family income of less than $69,000 per year. And up to 39% of the admissible expenses in 2025 can be credited. And this is adjusted in 2026, it'll be 40% and 41 in 2027. It'll go up for a few years again. But if you want to have more information, you just can go on tax credit for home support services, seniors on the website of Revenu Québec, and you'll have all the details. Now you might ask, are these people that are going to come to my house to give personal assistance services well-trained? Yes, they are well-trained. We have a program, FAPAC, and we'll give you an overview of the 8 skills that are developed with that program. So it's designed especially for us, and it's given by nurses and auxiliary nurses. So as I said, a quick overview of the skills that are developed through FAPAC program. So they'll train to adapt their behavior to be ethical and professional, use effective communication strategies to establish and maintain relation. Of course, they're trained also to prevent infections and contamination. We don't want to get you sick when we go to your house. Offer basic personal assistance services, offer personal assistance services that aren't restricted, the administration of medication, adapt the way you offer your services to the incapacities or capacities of the patient, and adapt the way you offer your services to the psychological context of the patient. So they're trained for that before they go to your house. There's also a specific training for those who will give the respite and stimulation of seniors. Those services, they're trained by our network to help caregivers to develop tools to offer quality respite services that are more than just guarding, During the time spent with the person, stimulation and social interaction is really our focus. And there's also a special complementary training that they follow, and it's been developed in collaboration with the Fédération of Québec Alzheimer's Societies to understand and work better with people who are touched by the disease or such disease as Alzheimer. We also have in our network a social geriatrics program. Marie-France talked a bit about the social geriatrics earlier on, but we believe that each senior should be able to be allowed to get older at home if he wants to. Social geriatrics, what it is, if you want to know more, it's a preventive approach. It's a prevention program that's aimed at detecting and treating accelerated aging. So through our network, we have around 9,000 home care support workers that act like sentinels to detect loss of autonomy and refer to the appropriate resources and partnership with the navigators when they need to. So if they go to a person's house and see that, oops, this isn't like it was before, they see a few signs, they can call up the CLSC and appropriate services. So that social geriatrics program is built in collaboration with Fondation Age. You might have heard before of Fondation Age, and its founder, the geriatrist Stéphane Lemire, who have a long and recognized experience in the domain. Increase, you might ask, I said a little bit earlier on that in the upcoming years, there might be more and more demand for the services of ÉESADs and organizations like us. There was a study that was made by l'École des Hautes Études Commerciales, the HEC, in Horizon 2040, projection des impacts du soutien de domicile. Well, it shows that by 2040, a projected increase of 69% of the needs in home care support to maintain autonomy in Quebec. So imagine if we continue with the main pattern we have now of placing seniors when they're starting to experience loss of autonomy, we would have to create more than 42,000 places built in long-term care facilities like seniors' home or Maison des Aînés by 2040. In other words, to double the amount of places now available. So is it very realistic in terms of the finances of the state? Is it very realistic finding the workers to work in those facilities, and also finding the workers to build those facilities? Maybe not. So it's better to improve the services for the people that want to age at home, and also more, and we see that a lot of seniors, they prefer having services and being able to age at home, to stay where they live. Current projects we have in our network, well, the inclusion of personal assistance services and respite services, and as well as maintenance and handyman services in the financial aid program. We very much hope that the representations that we made with the government, that they will include those in ÉESAD in policy that's coming up. So you would have help financial aid if you ask for maintenance and handyman services. I didn't talk about it earlier on, but it's offered in many of our throughout our network. So if you need to have a light bulb change, if you have to do a small painting task, install a pole in your house, such things, they can help. But now it's not covered by ÉESAD. We hope it will be in by the end of the year. We also work on improving the coordination between all the different partners of the service offered to help maintain autonomy, such as Meals on Wheels and the local volunteer centers and such. And we want to fully implement in a structured way social geriatrics everywhere in the ÉESAD network. Now we have 15 ÉESAD who have a very well organized program that's funded and everything, but in some other ÉESAD, it's partly implemented. But we ask the government to help us implement the social geriatrics program in every ÉESAD in Quebec. So home care support worker, maybe it's a job for you if you're still in good shape and you would like to give a few hours a week, or maybe someone you know, your daughter, your niece, or I don't know. So those training that I've talked about earlier on, FAPAC and Respite, they're paid training. It's a job that gives a feeling of being useful and to make a difference in the life of seniors. It's an opportunity to have meaningful encounters with seniors. So if you want to come work with us, or you know someone who would like to come work with us, there's a website, jaideadomicile.com, and they can give our name. And so don't hesitate to talk about it with people who could be interested, because we're hiring and we're going to be hiring more in the next coming years. A few websites to know more: the website of the ÉESAD network, the Aide Chez Soi website that I've talked about earlier on, that to find the nearest ÉESAD. There's a part of it that it's in English, but not all the website, but we have plans to have fully translated in the next years. Chez Moi pour la Vie is to show the support for better home care support in Quebec, and to apply to work with us, J'aide à domicile. So as I said, if you think about the ÉESAD, you should think about us as partners for the dignity of seniors and to help make their life more easy. So thanks for your attention and engagement for better home care support for seniors and person and loss of autonomy. And I'll be happy to take your questions.
So there was one question about how to know which fall alert system is the best for you depending on your needs. And I don't know if that's something that either of you are able to answer. I will put in the chat that there's a website called Medical Alert Systems Canada that compares 3 of the most common ones. So you can look at those different reviews and see which one you think would be best. I don't know if Marie-France or François wants to add anything else to that question.
I think it also depends if the person is living with a neurocognitive impairment like Alzheimer's or dementia.
Okay.
And if you're concerned about them getting lost in terms of adding the GPS tracker to
Right.
that device, or simply wearing, they're like bracelets. They look almost like a little watch. And if you sustain a fall, you can press on the bracelet or the bracelet itself will get activated. There's also necklaces. So it depends on the neurocognitive status of the person, and it depends, of course, on finances. There's different costs associated with different devices.
Yep. So those are important considerations, the neurocognitive status and cost. Another question came in about the eligibility or qualification for home care services, specifically, I think in the public system. Are either of you able to speak to that? Like what makes somebody eligible to receive home care services? At what point they can request help?
Things are always changing with the public healthcare system. I know, for example, for palliative care, people can prevail themselves up to 28 hours per week. Depending on their prognosis, I should say their documented medical prognosis. In terms of other home care services, it depends if the person needs nursing interventions versus personal care. And I know the government had overspent on the island of Montreal, they had overspent their home support budgetary envelope. So they were referring right, left, and center to all of us community organizations. So I'm not even certain at this point in time what their criteria is, but I think it's typically people with limited social networks, limited financial needs. Often people that are living alone will be prioritized as well.
Okay.
Maybe just a little complement of information about that. I didn't talk about it during my presentation, but we work closely in relation with the CLSC, or local CLSC, and sometimes, for instance, if the social worker goes to your place and evaluates your case and sees that you would need help to get out of bed in the morning, you would need help to prepare your meals and such, you can have reference from the CLSC for our services, and then it's paid by the CLSC.
So it's important to get connected to the CLSC to go through the intake process so that they can determine your needs and move on from there.
In terms of when you call the CLSC, the guichet d'accès, the access point is called SAPA, S-A-P-A. It's le soutien à l'autonomie de la personne âgée. So when people call the CLSC and they are a senior and they are looking for help, ask for the SAPA, S-A-P-A, soutien à l'autonomie de la personne âgée. Ask for the SAPA program at the CLSC.
That's really helpful. Okay. A couple of other questions that came in. One is about transport adapté. How would someone get access to that service?
There's an online form that people can complete. It used to be that it had to be completed by a physician. Now I think any other healthcare professional can complete it as well. The downfall is there's last I heard, about a 6-week waiting time between the time that you complete your adapted transport form and you can prevail yourself of it. But it's made much easier than it used to in the past.
Okay, excellent. And we have a question that just came in from one of our senior wellness centers in Lanaudière. They said they have an ÉESAD in their community, but they're having trouble meeting the needs because it's difficult to find trained staff, especially trained staff who can speak English and serve the English population. And just it's kind of a comment slash question with the projected phenomenal increase in the senior population. How can the government meet the needs of seniors? So I don't know if that's something that one of you want to tackle or have any comments to add.
There's two parts in the question. The one about
Yeah.
the services available in English in each ÉESAD depending on your region. Of course, if you're living in the West Island or if you're living in the Pontiac, for instance, it's maybe there are more persons working in the ÉESAD near you that speak English and can give services, but we're working on having services available in each region. And we have a survey each year with our members, and we're planning to have a question specific about that in the next survey to know if there are some ÉESAD that still have no or very few trained person that are able to give services in English. So that's for that part of the question.
The home care action plan that you spoke about a little bit before looks at some of the ways that the government is trying to meet the needs of seniors with the increasing population. And I don't know that it might be beyond what we can address in today's webinar, but it is something that's of, great concern and great importance.
But also, if Marie-France talked about your local M&A. If you talk to your local M&A, it's important to tell them that there aren't enough services now, and that it's important for the government to invest in home care support, and it's cheaper in a long term than to invest more in people going to the hospital because they haven't had the services that they needed at home, or going to a CHSLD because they haven't had the service that they needed at home to stay home longer. So it's worth it, but you have to convince the government to invest more in better services and home care services, because obviously there's going to be more and more needs in the upcoming years.
Thank you so much, Francois. Super informative information. And I think between both of you, Marie-France shared a lot of sort of basic information about what is home care, what types of services are available, some great resources in the community, and then with the information about the ÉESAD network, it fully rounded out the presentation. There was one last question about whether we'll send all of the acronyms and contacts from all of the resources shared today. So yes, of course we will. We send a follow-up email to all of the organizations, and then they reach out to the individuals who have participated. So if you want more information, reach out to the organization that invited you. They will have all of the resources that we talked about today. So I just want to take a moment to thank both of you for your time this morning and the super valuable information that you shared. We learned about home care services in general, how to stay safe and autonomous, how they can help you to stay safe and autonomous in your homes, why it's important, what's available, how to access. And then we heard about the specific services available through ÉESAD and the financial aid available in order to access them. So I hope that you learned something that will be helpful, and I hope that you share what you learned with somebody who wasn't here today so that we can continue to spread awareness and spread information. And thank you again to the organizations and the SHARP coordinators and all of the participants in today's presentation, to Megan for the technical support. And again, Marie-France and Francois, thank you so much for your valuable presentations. And we look forward to next month's.